Welcome to another episode of The Brand Called You, a podcast and podcast show that brings you leadership lessons, knowledge, experience, and wisdom from thousands of successful individuals from around the world. I'm your host, Ashutosh Garg, and today I'm delighted and privileged to welcome a very senior professional from the corporate world from Gurgaon, India, Mr. Rohit Gulati. Rohit, welcome to the show.
Thanks, Ashutosh.
Rohit is, as you were just telling me before we started recording, a bee farm and has now become a very senior healthcare business leader. So, Rohit, before we talk about healthcare marketing, tell me a little bit about your own journey.
So my journey has been very unique. I come from a very small town, Ashutosh. I come from a place called Kanpur, which is a tier 2 city in India. My father was based out of that city, and we actually did our schooling from that place. Coming from a small town, you have dreams to make it big,
Correct.
And that was the journey which I took from Kanpur to Gurgaon today. And obviously, a illustrious career in healthcare. Have been a healthcare guy since the beginning. Have done my pharmacy right in the beginning of my career, and then did my MBA and more of executive management education throughout my career to sharpen my skills. But I think it has been a great journey for me in healthcare. The journey has been very rewarding, very enriching, and more to do so with touching the lives of patients. I think that has been the purpose behind my career, to touch as many patients as possible. And that's motivated me to do much more in healthcare and through my journey.
How wonderful. So let's talk about marketing, since you before we started recording were telling me that you've been a sales and marketing professional all your life. Let me start by asking you that how has the healthcare landscape in India evolved over the last few years, and how have you adapted your marketing strategies to respond to these changes?
Great question, Ashutosh. I'll start from the 80s, Ashutosh. There was privatization, commercialization in India. 90s was the era where the pharma companies and medical device companies sprung up and started to grow very strongly in India. MNC started to come inside India. That was also a time when insurance penetration had started, right? So from that time to now, there has been a huge change in how the industry has evolved. So I'll talk in a few areas in which the industry has evolved. First, to do with how surgery has evolved in the healthcare industry.
Right.
The surgeons used to do open surgeries. Today, they do minimally invasive surgeries with least amount of blood loss. Right. Technology has advanced in medical technology. Right. We used to have very early technology which surgeons used to use. Today, we use a lot of robotics in surgeries as well. So the way technology has evolved over a period of time has been very rewarding, not only for healthcare professionals like us, but also on the other side for the surgeons at large. Now, if I look at infrastructure in healthcare also has gone and grown by leaps and bounds. We used to talk about healthcare largely in the metro cities or the tier 1 cities. Today, healthcare has been penetrated inside tier 2 cities as well. So if you look at, and more so in the COVID time, more so in tier 2 cities, the infrastructure has evolved. Huge infrastructure evolution has happened. And COVID was the trigger so that the tier 2 cities evolve in the infrastructure, and that has happened really well. Coming towards digitalization, again, COVID helped in digitalization as well. So digital transformation has been huge in healthcare in the last few years, more so after COVID. The Modi government itself is putting a lot of emphasis on healthcare. If you look at some of the largest schemes which Modi government has rolled out in India, which is the Ayushman Bharat, which is catering to a lot of people below poverty line, and more so 40% of our population. in that bottom strata with 5 lakh insurance. That's huge, right? And that also shows a lot of focus on the government now coming towards healthcare. The percentage proportion to GDP in healthcare is growing. Every budget that's growing.
Correct.
Right? Used to be less than 1%, right? It's growing now towards 2.5% now.
Absolutely.
So that's the evolution which we have seen in healthcare at large, from surgeons' perspective, from infrastructure perspective, and from the government perspective. So I think the future is bright for healthcare in India. Absolutely. And I see healthcare as a growing opportunity in India, not only for corporates, but for other professionals as well.
Well said. Well said. You also spoke, Rohit, about COVID-19 pandemic. What were some of the key marketing challenges and opportunities that emerged during the COVID period?
Again, this was something which jolted the healthcare industry when COVID happened.
Correct.
Right. So healthcare was at the center when COVID happened. It was happening with the, it was a healthcare issue, and the industry was also getting affected. So I'll talk in terms of what COVID did to all of us in terms of from moving from physical to hybrid, over a period of time. A lot of conferences in healthcare actually happen physically, right? And they happen over the weekends. So all these conferences stopped, right? Because of COVID restrictions, there were shutdowns. The sales teams could not visit the surgeons. So it was a lot of introspection from a healthcare perspective that if the healthcare services are busy today, right? The surgeons are busy with patients today. The patient overload in hospitals is very huge. How does the industry communicate with the healthcare practitioner? Because a large part of marketing in healthcare is driven through the healthcare practitioner. Now, how do you access that guy who's busy in treating his COVID patients, right?
Correct.
That was the challenge which was posed. So, what happened was that the change, the digital drive, which had to happen in healthcare in the next 10 years, actually happened in the healthcare sector in 3 to 5 years. So that's the acceleration which happened, especially in the digital part.
Right.
A lot of digital solutions came up. If you see solutions like telemedicine, they emerged during the pandemic time, and they were good means by which the patients could actually communicate directly with the surgeon. Surgeon was also taking less amount of time. They could do 4-5 calls quickly through telemedicine, and they could move to their patients in the hospital. So telemedicine grew, right? And that was an indication that technology should be used in healthcare much more, much deeper, and more cost effective as well.
Correct.
Right. So technology platforms emerged. There were a lot of technology platforms which emerged. A lot of startup companies actually came up in this area. And so a lot of marketing started to evolve in that direction, that how do we use technology to communicate with the surgeons or communicate with the hospital.
Right.
A lot of the demonstrations, Ashutosh, happen in the industry physically, right? So if there's a medical device, the surgeon needs to actually use the medical device inside his theater.
Right.
Without using the medical device, he cannot give us feedback, right? So the challenge was, how do you actually do a virtual connect with the surgeon and discuss the medical device, and he is able to look at the medical device. We sitting at our head offices are able to connect with him in his hospital, so that time spent is less, more meaningful and value driven, right? So I think leveraging a lot of these resources, leveraging technology, cost effective technology, to look at scaling up over a long period of time was something which the marketeers started looking at, right? And that has actually helped us grow over a period of time as well. So digital today forms a large part of revenue as well, in terms of the channel in which we communicate with the surgeon. And a lot of leads come to us through the digital channel as well, which we were not using as much before the COVID times.
How interesting. How interesting. But do you think this whole move towards digital is something that's going to be there to stay in the long run, or will it go back to face-to-face meetings?
I think, what we have understood over a period of time, digital in isolation will not work. Digital has to be substituted with some kind of hybrid model. So digital needs to be there, but obviously face-to-face in healthcare cannot be eliminated. We need to meet a surgeon right in the morning in the operation theater to understand what's happening in the operation theater and know our products, how are they getting used, right? So that physical connect in healthcare cannot be substituted. So that's what we have learned over a period of time, that hybrid is the way to go.
So, for a very, very long time, there were only 4 products available, if I can use the word products, as distinct from medicines. The thermometer, the glucometer, the blood pressure meter, and the weighing scale.
Correct.
Now there's a lot of more inputs coming in where consumers can actually start to buy a lot of medical devices.
Yeah.
Do you see this kind of trend continuing, where more and more home care devices will start going into consumers' homes?
Yes. So home healthcare is going to grow, right? And this is one area of healthcare which is set to grow at a multiple CAGR, more than 20. Next 4-5 years. And people have realized the fact that you can now even do, for example, chemotherapy sitting at home, right? You need not go to the hospital. If the hospital has infections, COVID infections, and you don't want to go, right? You can call the home healthcare arm of every hospital today have started a whole home healthcare arm.
Absolutely.
And these guys can come into your house and treat you, and they can treat you really well at the comfort of your home, right? So a lot of these devices have started coming because there is an opportunity for even the local companies in India to make such devices. And if you remember, in COVID times, there were a lot of oximeters, right, which were floating, right, in the market. Even a lot of Indian companies started making a lot of oximeters. Now, what's critical here is that medical devices are regulated by certain quality norms, right, and certain regulations, because all these devices have to be regulated by the CDSCO in India. And when they get regulated, they get checked, right, that are they accurate, right? And because a lot of these products which were floated in the market were inaccurate. So for example, one oximeter would give you one reading, the other oximeter would give you another reading, right? So I think what's happening now is that we are trying to regulate this device market going ahead. This was largely an unregulated market.
Correct.
Today, it's getting more regulated. Over a period of time now, it's getting more regulated. And a lot of devices are getting regulated.
Well said. And Rohit, as a marketer, what role does data analytics and customer insights play in your own marketing decision process?
I think customer insights are the core of marketing, if you ask me. Customer insights are like those wow moments for a marketer, which are like going to give him direction, not only for his product, but for his portfolio as well. So what we generally do is that, in medical devices, we try and ask every marketer to go inside the market, understand what the surgeon or the hospital is currently using as a baseline in that particular area. For example, if he goes into a cardiac surgery and the product is a stent, so we want him to observe what is he currently using, right? To understand the surgeon's practices, the surgeon's needs, the gaps in that area, and then come back and understand whether the product which he's launching in the market, is it going to solve an unmet need? What kind of benefit or value is it going to add to the surgeon, right? And when we launch such a product, in the pre-launch stage, generally, Ashutosh, we want every marketer to come up with these customer insights, right? That what was the feedback on the product from the surgeon? Did the surgeon find value in using the product? Did he find, further use in what the company is saying about the product, right? So what's the feedback from a patient's perspective? Were the patients happy with the product, right? Because at the end of the day in healthcare, it's all about the end customer, which is the patient. So if the patient is happy, the outcomes are good from the surgeon's perspective. The surgeon says, okay, you have got a good product in the market, right? I'm happy with the product. I feel, this product is going to be revolutionary inside the market. So that's how the customer insights really work. And I always tell this to all the marketeers that you need to go inside the operation theater to learn more and learn more about customer insights. Without standing inside the operation theater, you will not be able to learn. So that's one area of learning. And a lot of data analytics come out. Once you gather these insights, every insight today is in every multinational company, we have something called as a commercial analytics team, right, which looks at a lot of data coming from sales teams, and it is generated on a daily basis. So how do you make sense of this data? If a sales guy is visiting, say, 10 surgeons and has these kind of insights every morning, how do you make sense, and how does a marketer look at this data at large and say, okay, this is where the opportunity lies, right? And this is where I can go with my product. So I think that is very, very core to marketing.
Very interesting. Thank you. Great response. My next question is on how are healthcare marketing professionals addressing the affordability and accessibility of healthcare products and services in India, and what marketing strategies could be employed to reach the underserved population?
So very, very good question, Ashutosh, because this is something which we always ponder, and most MNCs find it difficult to reach out to as many customers. There's always a trade-off,
Correct.
If you have a large sales team, can you make a product affordable? If you have a small sales team, how can you make your reach higher? How can you go at the bottom of the pyramid?
Correct.
Right. So I think few things which we have seen is which have worked, and over a period of time, a lot of companies have started using is financing in healthcare.
Okay.
So there are a lot of surgeons in India who come out of medical colleges, who are young, fresh, who do not have that much amount of money in their pockets, right? When they start their own small clinics. I think how can industry support them is one way is that you can look at financing options, right? You can tie up with NBFCs, tie up with banks, and give them better financing options,
right,
over a period of time, and they can pay for the equipment over a period of time because they are ambitious. They want to grow. They want the best instruments I've seen, right? They will not compromise. They want an instrument, but they don't have money. So that's the proposition they come up with. Right? So that's one. Number two, innovative business models. How can you eliminate the middleman or the distributor and have direct digital models today, right, to reach to the customer? Sometimes you have very niche products, right? So it's important to use digital. Your customer might be sitting in the corner of Coimbatore because you have a niche product, right? So you need not have a large sales force, but you should know where your customer is sitting for your niche product, right? So innovative business models, number two. Make in India, number three. This is something which a lot of medical device companies are contemplating, right, to start manufacturing in India. Of course, obviously, there's a long process depending upon company to company today in India.
Correct.
And approval, there's a long approval process, which every MNC goes through. So either you manufacture the complete medical device in India, or you probably do some part of, say, packaging or some part of the manufacturing in India. The government actually looks at subsidizing and gives incentives today for Make in India medical device companies. There are a lot of parks, the tech parks, which government of India has developed. One of them is in Hyderabad, where a lot of medical device companies have set base, where they do Make in India. They do a lot of R&D efforts as well. So I think India is moving towards, a lot of MNCs are moving towards Make in India as well. So I think if you see, these three areas will help most MNCs reach out to as many customers as possible. And once you do make in India, your products are affordable, right? Much more affordable.
Correct.
So I think these will, and our rankings will improve, right? We have 145 among 195 in affordability and access in healthcare today. Right? We need to do much more.
Absolutely. I agree. So Rohit, I have time for two more questions. My next question is, how do you foster a culture of innovation and creativity within your own team to stay ahead in this very highly competitive industry?
Yeah, great question again. So marketing is all about innovation and creativity.
Correct.
And I've always said that creativity, to happen, creativity in an environment to happen, you need a stress-free culture. So without stress, only your creative inputs can come out, right? So very important that when marketeers want to think creatively about their product, their portfolio, their go-to-market strategies, they should first go into a stress-free environment or take a break, right? And then start thinking, right? And what we also encourage is every idea matters, right? No idea is big or small. It's important to come out with an idea, and that refinement can happen in every idea, right? So it's a continuous improvement process, right? Upskilling is very important. When you do creativity, we want our teams to get upskilled as well. So a lot of effort goes in training and development of our teams so that they can at least start thinking more creatively and more innovatively, right? Sometimes if they're unskilled, you will not be able to think that much creatively, right? And constructive feedback. So when you are in a creative pathway, it's important to give very constructive feedback and ongoing feedback, right? And have that kind of open communication between the team. That fosters a lot of innovation and creativity in the process.
Right. Very interesting. And my last question to you, Rohit, and this is for the many, many people who will listen to our conversation. You've had an incredible journey so far, and I'm sure there's so much more planned for you ahead in the years ahead. But based on your own amazing journey and the fact that you've reached so high up in a large pharmaceutical company, what would you say are 3 lessons you would want a lot of our viewers and listeners to take away from your own journey and from our conversation?
I think 3 lessons, Ashutosh, which I want our viewers to take away is number 1, keep learning, because learning is a continuous process. And sometimes, when we reach at a certain stage in our careers, we stop learning. So, keep learning. Those learning should never stop in the process. It's a continuous journey. Number 2, have mentors. I think it's important to have mentors in your leadership journey. Because mentors would give you a lot of those feedbacks.
Correct.
As well as make you aware about yourself. Right? As they say, self-awareness is very critical in a leadership journey.
Correct.
So I think mentors have really helped me over a period of time, and I've had very good mentors in my career. Who have actually shown me the right path.
Wonderful.
So, and I still continue to have really good mentors for my journey ahead. And number 3 is, I think, give back. When you are growing, also try and give back. Give back to the society. Give back to your teams. Try and give back to as many people as possible. The more you give, the more it will come back to you. Right. So I think these 3 things I've followed throughout my career, and I keep following it.
Fantastic. Great lessons. And on that note, Rohit, and your 3 amazing lessons, keep learning because it's a continuous process. Second, you said was have mentors in your journey because they can provide you a lot of input and support as you move forward. And the third one, which is so important, is to give back. Thank you, Rohit, for speaking to me about your own journey. Thank you for speaking to me about so many different aspects of marketing in the healthcare world. I think there was many, many things I learned from you today. Thank you again for speaking to me, and good luck.
Thank you, Ashutosh. It was lovely speaking to you today.
Thank you. Thank you for listening to the Brand Called You videocast and podcast, a platform that brings you knowledge, experience, and wisdom of hundreds of successful individuals from around the world. Do visit our website www.tbcy.in to watch and listen to the stories of many more individuals. You can also follow us on YouTube, Facebook, Instagram, and Twitter. Just search for the Brand Called You.